Ebola, which is widely known in Africa, is a deadly disease that causes hemorrhagic fever or profuse bleeding inside and outside the body. Along with bleeding comes a very high fever and nausea. Scientists believe that the Ebola virus was likely to originate in Africa from African fruit bats. Unlike other viruses, one must come in direct contact with bodily fluids of someone who has Ebola to contract the disease. Bodily fluids include blood, sweat, semen, urine, vomit, and feces. Transmission can occur through the eyes, nose, or mouth, through an open cut, wound, or through sexual contact. Ebola is hard to diagnose. The early symptoms of the virus closely resemble that of the flu, malaria, or typhoid fever. The only way to identify the Ebola virus is through a blood test that reveals either unusually low or unusually high white blood cell counts, low platelet counts, elevated liver enzymes, or abnormal coagulation factor levels. Unfortunately, the Ebola virus does not have a cure and a vaccine to prevent the virus. The only course of action for an Ebola victim is keep them as comfortable as possible in their final days. Comfort measures include giving medications to maintain blood pressure, managing electrolyte balances, providing extra oxygen, and preventing other infections. The impacts of Ebola. As new cases of the Ebola virus decrease, hopes grow in West Africa that the virus can be eradicated. However, there are still many obstacles to overcome to rid the developing nations of this deadly virus. Healthcare systems are devastated, education has been lost, and distressed social structures face all of those who have survived Ebola. Many children in countries of Africa like Guinea, Liberia, and Sierra Leone have lost at least one or sometimes both parents. This becomes the largest obstacle UNICEF faces. Manuel Fontaine, a UNICEF regional director for West and Central Africa, noted, "Thousands of children are living through the deaths of their mother, father, or family members of Ebola. Nearly 3,700 children in West Africa lost their parents, leaving them to be orphans." In Sierra Leone, a small population has been affected by Ebola, but the largest impacts are on household welfare, resulting from indirect measures taken to restrict disease spread and general disruption of the economy. As of June 7, 2015, Sierra Leone has reported close to 13,000 cases of Ebola and over 3,900 deaths since the outbreak began. But progress has been made. In recent months and past weeks, there have been a reported maximum of 15 cases per week in result of the nationwide lockdown and dramatic efforts put forth to contain the disease. According to Sierra Leone's agricultural minister, Joseph Sam Cisse, the economy has been deflated by 30% because of Ebola. The agricultural